day I'm on in there, but I think I'm probably about maybe almost a third of the way done with that thing. And been sleeping a little better on some of those times. I may just be having some of the telomere benefit myself. And so, again, I will give you guys a complete review of what my thoughts are on this Neurocycle app when I'm done, for sure, because, I'm learning a whole lot of new things each and every single day, and there's always things to learn every day. But sometimes, you gotta look a little inside and just check it all out. Not a bad idea to do. Anyways, jump onto our Herbal Wellness Corner, brought to you by High Horse Cannabis Company, guys. Hey, taking a look tonight, interesting study that's coming out today. Let's take, just unpack some of this stuff. What I find interesting about this study here is that, it's not directly an attack on cannabis. It's not quite an attack on THC, but perhaps actually relevant and or maybe even useful information. It's not, weed influenced maniac crazed killer caused all kinds of problems, right? This is an interesting, genetic possible situation. THC metabolism can influence cannabis use disorder risk. Cannabis use disorder, cannabis hyperemesis syndrome, right? It's not necessarily quite what you call addiction, but yes, it can be, an upregulation of, your CB1 receptors, desensitization towards THC use, which kind of will backfire on some of the receptors in your brain, such as, or neurotransmitters in your brain, such as like dopamine, right? And, obviously that plays a whole lot on a whole lot. So anyways, summary here is researchers linked differences in THC metabolism to varying effects of cannabis use and the risk of developing cannabis use disorder. The study, which included young adults without cannabis use disorder, found that genetic differences in THC metabolizing enzymes can lead to stronger and longer lasting effects of cannabis, especially among females who metabolize THC more slowly. The connection between THC metabolism and cannabis use disorder risk, particularly observed in a younger demographic, underscores the importance of understanding individual physiological responses to cannabis. The findings also suggest potential for targeted interventions and the need for educational programs to inform teens and young adults about their unique risks regarding cannabis use. Key facts coming out of the Medical University of South Carolina: sex-specific effects. Females with slower THC metabolism are at a higher risk for cannabis use disorder, while males with similar genetic variations report more negative initial effects of cannabis use. Genetic influences include about 25% of people have a genetic variant that results in slower THC metabolism, impacting the intensity and the duration of cannabis's effects. And the educational importance studies highlights the need for educational programs that address individual differences in cannabis experience and the risk of cannabis use disorder, particularly among adolescents. A lot of good things to unpack there. And, overall, I think my thoughts, because of course, medicine should be very personalized, right? And, when you're looking at cannabis in that aspect of cannabis as a medicine, and putting things into your body, everybody has their own dose, right? Some things can be dosed per your gender, per your kidney function, so on and so forth. And cannabis may have at least particular dosing considerations that, should be taken into account for users. And maybe some users might wonder why they're a little bit more sensitive to cannabis, why it's perhaps maybe a little harder for them to get off of cannabis and to break through some of those THC desensitization protocol thresholds, which, for most people, a 48-hour THC detox can reset a lot of that system of your CB1 receptors and your upregulated dopamine and all those responses that are cascading in the body, and almost, I know it's, for people with cannabis use disorder, you may feel like you don't want to eat for multiple days, right? And things like that, to be able to take that 48-hour break, which can cause a whole lot of dysfunction in your regular life, aka thus you just continue to use cannabis in extraordinarily high doses, which is okay for some, but for others it could be causing other ripple effects that affect your life overall. And so I think if people understood their risk a little more, or just even understood the mechanism behind it, you may at least have a little bit of a better decision-making process to say, hey, if I'm, going to be a little resilient to try to make it through a desensitization protocol, you can perhaps even stabilize your dose, right? And perhaps even fix a whole lot of the issues that may come from somebody with cannabis use disorder. And again, cannabis use disorder, few and far between, but it happens. Some people with extreme GI upset anytime the cannabis levels go down in the body, from nausea to vomiting, to any other GI problems and just complete stomach pain, I've seen it few and far between. Really doesn't happen a whole lot, but again, can happen, especially, right, if you're looking at users that may be using things like highly potent concentrates right off the bat, right? That vape pen is going to be one of your easiest ways to get like incredible amount of dosing without even realizing it, and then just continue to go back to it just because hand to mouth, right? And so maybe some of that internal locus of control isn't quite there, and it's really easy to get out of control with something like a vape pen, for instance. And somebody might realize, this one could potentially put me beyond, the dose that I really need to feel therapeutically great, and then thus almost kind of create a dependency and a physiological response when cannabis is not in the system, specifically THC. But the beautiful part about that is things like CBD can actually mitigate, right, cannabis use disorder and help people to get off of THC. And that's the beauty of the other 200 plus phytocannabinoids in that plant plus terpenes, right? So it doesn't have to be just THC all the time. We know in a lot of cases, and especially the industry currently, THC is the popular, cannabinoid of choice, of course, right? It's the federally controlled substance, Schedule 1, no approved medical use according to the U.S. government, even though the U.S. government has the patent on cannabis. Anyways, jump into our, community spotlight there. And you guys definitely be sure to shop High Horse 24/7, 365. I'm absolutely pumped up for the SE Awards coming up here in about 2 weeks. It's going to be really great. Sunday evening, I believe April 7th, if I'm correct on my days. Fingers crossed for Farm True, fingers crossed for High Horse. Let's run away with some of this, hopefully. Anyways, Community Spotlight brought to you by the Baked Chicken Farm. Talking about another bird this evening. That's the Centennial Hawks, our local newest, awesome high school up here by A Mountain in Las Cruces. But check out this, the Hawks blanket raffle for nationals. There's a first place prize of a $200 hand knitted Centennial Hawks blanket. Second prize, $40 gift card to Raising Cane's. So the teachers at Centennial raising $5 each, except Cash App. I guess this teacher specifically who posted it to the Las Cruces Community Watch, her Cash App is Tiff Baugh, if you guys can see that there. Anybody looking to get in that blanket raffle, $5 each, helping get to nationals. Local team that is trying to obviously, fundraise and do these things, and that's what we got to do as a community, is take care of one another, in all these ways that we can. So want to shout them out. I know it may be a little harder to see on the screen, but again, the Centennial Hawks blanket raffle, if you guys haven't seen that shared from any of the Centennial Hawks teachers or the staff that you kind of know on Facebook or anything like that, go to the Facebook Las Cruces Community Watch page. It'll be right there, top and center if you're having a hard time seeing this right now. Otherwise, right, $5 to get yourself, a couple chances to get the sweet knitted Hawks blanket plus $40 gift card to Raising Cane's. All right, last thing in the evening, Men's Health Minute sponsored by Vado Speedway Park. Easter Egg Extravaganza happening next Saturday. This Saturday, the Bravo Mike Easter Hunt and Spring Fiesta Party over at Young's Park will be happening all day, but no racing this weekend. Kicks back off next Saturday over at Vado, and it's going to be a cool Easter egg hunt. It's always a great time. They do a really, really cool job out there for sure. I can tell you as a guy who's been the Easter Bunny multiple years down there and had a great time too. Anyways, so look, this one, testicular cancer incidence and mortality in New Mexico. This was a study done in 2020 examining the incidence and survival of testicular cancer in New Mexico overall and separately for border and non-border counties. So looking at it, the incidence and 5-year survival rates for testicular cancer were obtained from the SEER-18 database using the SEER-STAT program. Only established NCI protocols. Incidence data were compared using students' t-test. Age-adjusted 5-year survival and Kaplan-Meier method were used to estimate survival. Log-rank tests were used to compare survival for New Mexico to the remaining 17 geographical areas of SEER-18 and for the New Mexico border counties to the New Mexico non-border counties. Odds ratios were used to compare testicular stage diagnosis and Cox proportional hazard regression were performed to account for race, ethnicity, and border status. Anyways, for anybody what does that mean, right? What the results came out for 2000 and 2015, New Mexico had a testicular cancer incidence rate of 6.3 per 100,000 people, significantly higher than the CR18. The 5-year survival rate in New Mexico did not differ significantly higher than the 16, but border Hispanics had a lower survival rate than border non-Hispanic populations, and from 2000 to 2018, New Mexico had a significantly higher proportion of distant cancers than 18. So conclusions being, the higher incidence of testicular cancer in New Mexico does not have a clear explanation. Based on the current understandings of risk factors, however, the increased incidence in New Mexico does not appear to be associated with increased mortality. Our proportion of advanced testicular cancers in New Mexico may represent a delay in diagnosis, and the increased mortality rate seen in Hispanic border populations may be due in part to barriers to care. So, as we talked about in Health Minute, go and get those screenings done, right? Definitely, if you're a male above the age of 30, definitely be doing a check once a month, but again, going to the doctor, getting that physical, we can, take a good dent at really preventing those things. And with the overall, situation of avoiding the doctor because it's just, the manly thing to do. Again, what is going to be the result of that disease progression when things can get perhaps handled a little easier, whether it's cardiovascular problems, high blood pressure, prostate cancer, testicular cancer, some of these common things that are affecting men in the States, and we could absolutely do a better job on. So, our Men's Health Minute I brought you by Badu Speedway Park. Just want to make sure that, men, check them. All right, guys. Hope you have a good evening. Happy hump.